In another study, what we did was that we induced DNA mismatch repair deficiency on neuroblastoma tumors. Neuroblastoma is a form of childhood cancer, which is common in babies. And these tumors are often non-immunogenic and they're very aggressive, and they don't tend to respond to immune checkpoint inhibitors. So what we did was we induced mismatch repair deficiency in these tumors, because we know from the clinical evidence that patients who have mismatch repair deficiency in their tumors, they tend to respond better to immunotherapy. So we knocked out the DNA repair gene MLH1 that's important in this pathway in these tumors. And what we learned was that after we did this, these tumors became quite responsive to immunotherapy with anti-CTLA4 therapy, but not to anti-PD-1. And in our mechanistic studies, when we treat animals who that are transplanted with these mismatch repair deficient tumors, we learned that CD4 positive, ICOS positive T-cells are increased in the tumor in animals that have received these mismatch repair deficient tumors and they have received the drug. Also, we see a depletion of T regulatory cells in these tumors, which further supports the activation of anti-tumor immunity. And we think that both mechanisms are involved: increase of ICOS positive T cells and depletion of Tregs that allows for a very robust response against these tumors, because we can effectively cure 70 to 80% of these animals and induce long-term remission in them. And even later on, if we re-challenge them with the same tumors or less immunogenic versions of the tumors, these animals are able to reject these. And the implication of this for patients is that this is a proof of principle that shows that inducing mismatch repair deficiency, even in a type of cancer that is highly immunosuppressive, can sensitize these tumors potentially to anti-CTLA4 therapy. And this approach can be used by developing small molecule inhibitors that could in the future be used in combination therapy with these forms of immunotherapy in these patients.